Lost in the discussion of defunding Obamacare and the failed effort in Congress is the fact that failure means the government's ability to defund your life through the Obamacare's Independent Payment Advisory Board, the IPAB. I've been calling this the Politburo. The IBAP is regarded by many, starting with former Alaska Governor Sarah Palin. This Sarah Palin is not only smart as can be, which is why they attack her. This woman has courage and charisma. She's a leader, unlike these marble-mouthed mush types all over TV and in Congress. So the IBAP is regarded by many, starting with former Alaska Governor Sarah Palin, as a death panel whose decisions based on cost-effectiveness would result in health care rationing. This is particularly you folks on Medicare. Now, a glimpse of this brave new world can be had by casting a glance at our neighbor to the north. There, Canada's Supreme Court ruled 5-2. And by the way, don't think this is far-fetched. I can see our Supreme Court doing the same damn thing. That under Ontario's Healthcare Consent Act, which has been on the books for 2 decades, doctors cannot overrule a family's wishes for an incapacitated patient regarding life or death decisions. But an administrative tribunal can. You got that? In 1996, Ontario's provincial legislature created the Consent and Capacity Board, a body with the power to make the final decision when doctors and families disagree on keeping a patient alive, with continued treatment or pulling the plug, a conflict that can result in endless legal battles. At issue in the Ontario case was the fate of Hassan Rusoli, a retired engineer who suffered complications following brain surgery 3 years ago and has been in a vegetative state in a Toronto hospital ever since. Now, doctors say there's no hope of recovery, but the family doesn't want to turn off life support. The court ruled that doctors could not overrule the family's wishes, but are able to appeal to the Consent and Capacity Board, which could. Can you imagine? Canada has a full-blown single-payer system, which Obama is undoubtedly aiming for. So the question of when it is cost-effective to treat or keep patients alive becomes more of a matter of space and budget rather than a medical issue, and I might add more than a family issue. The question of whether one's life is worth saving or one's condition is worth treating remains a key part of Obamacare, even while being eclipsed by political maneuverings and enrollment difficulties. And having that decision made by a body such as the APAB, which is in Obamacare, has led to legislative efforts to pull the plug on Obamacare itself. A House bill to repeal the IPAB attracted 22 Democratic co-sponsors. Now, Senator Mark Pryor, Democrat of Arkansas, co-sponsored a Senate repeal bill after spending the previous 3 years defending the IBAP. This guy, Arkansas, please, throw this bum out. He's another fraud. The Senate and House measures had, at last count, 32 and 192 co-sponsors, respectively. Under Obamacare, IBAP's board of 15 presidentially appointed so-called experts will be empowered to make arbitrary Medicare spending cut decisions with virtually no congressional oversight or control. Its decisions will not be made on an individual level, but it will decide what treatments and therapies are cost-effective and therefore covered, affecting and possibly costing the lives of those in need of them. So let's say you have an elderly mother in a hospital who needs a certain type of treatment that's expensive. And you go to the doctor and you say, look, I want to keep my mother alive. I'm willing to pay, or does the insurance cover it, or what have you? The doctor says, look, there's nothing we can do. There's a regulation here. It says, I cannot spend this money for this procedure. I cannot spend this money on this drug. Why is that? Because the IPAB said so. Well, I want to appeal that decision. There's nowhere to appeal. Well, who do I speak to? There's nobody to talk to. You're done. Your mother's done. Now, I know the left in this country wants you to be bamboozled and confused and confounded, that such a situation can never occur. Ladies and gentlemen, such a situation is going to occur, and it's going to occur a lot. The federal government is taking life and death decision-making in many respects out of your hands and out of your family's hands. This is the control the statist left, the utopian statists, as I call them, have always wanted over you. It goes back to Plato's Republic. It goes back to Thomas More's Utopia. This is the power they've craved because they control you. Not just your assets, Not just the kind of automobile you can drive, not just your toilets and your light bulbs and the shower heads and the toasters and all the rest. No, they control you, the physical and mental you. And as you've seen with Obamacare and the waiver that they received on the subsidies, they will live under a different law than you live under. It applies to you, not to them. They go on at Investors Business Daily. Its decisions will not be made on individual levels, but it will decide what treatments and therapies are cost-effective and therefore covered, affecting and possibly costing the lives of those in need of them. We've documented for years, as have I on this program, how socialized medicine around the world, particularly Britain's National Health Service, makes centralized decisions based on cost-effectiveness rather than on medical need, and how this has led to rationing and denial of service. People literally die while on waiting lists. Obamacare tries to apply that same approach to Medicare through this Politburo, or Sarah Palin aptly said, the death panel, the IBAP. Kill this damn law before it kills us.